Well, hello, and welcome to Module 13. During this module, we will be discussing problems of immobility or musculoskeletal problems in children. So we know that children are normally running, playing, jumping, and are very active. So when a child has a musculoskeletal disorder, it can be very disruptive, at the very least, to their normal development. So pediatric nurses need to really understand how immobility affects children. Some of the disorders that we will be discussing in this module include very common things like fractures, but then more uncommon, but things that you need to be familiar with as a pediatric nurse are things such as scoliosis, Duchenne's muscular dystrophy, Legg-Calvé-Perthes disease, slipped capital femoral epiphysis, which is also called SCFE, developmental dysplasia of the hip, how to recognize that, and did I mention juvenile idiopathic arthritis, or JIA? So when caring for pediatric disorders of immobility, nurses need to be aware of the different skills or cares that we provide for children, and that includes casts. So how do you care for a cast with a child? The Pavlik harness, or what we use for developmental dysplasia of the hip, and certain braces and traction. So one of the common disorders that we need to make sure that we understand as pediatric nurses is about cerebral palsy, or CP. And cerebral palsy is a problem that affects muscle tone, movement, and motor skills. So there's many kids that have cerebral palsy that have perfect intellectual functioning. Now, sometimes the child can have a brain disorder which affects not only cognitive functioning, but also muscular development. So they can have CP and intellectual dysfunction. But CP really affects the child's ability to move in a purposeful way, in a coordinated way. So CP can affect other body functions that involve motor skills and muscles like breathing, bladder and bowel control, eating, and talking. So cerebral palsy is often caused from brain trauma before birth or at birth, but definitely in the first few years of life. There will be some type of insult which will cause this brain problem and result in CP. Sometimes it's premature birth that can cause brain damage. Another disorder that we will focus on in this module is muscular dystrophy, or Duchenne's muscular dystrophy. And that is a genetic disorder that is characterized by progressive muscle degeneration and weakness. And it's due to alterations in a protein, which is called dystrophin, which normally keeps the muscles intact. So Duchenne's muscular dystrophy affects about 1 in 5,000 males at birth. And pediatric nurses that will care for children with muscular dystrophy really need to assist families with very complex issues. This is not like scoliosis. Children with muscular dystrophy have this progressive weakness and will inevitably end up needing to be in a wheelchair. Normally this happens at about 12. Kids with Duchenne muscular dystrophy will inevitably go into respiratory failure because you need your muscles to breathe. So whether or not to use a ventilator at night, this becomes very challenging ethical issues to discuss. And children may be at a different point than their parents are in dealing with this. So really trying to get the whole family's perspective and preparing them for this is so important for pediatric nurses to do. Now, the average lifespan of a child with Duchenne's muscular dystrophy is 26, but with good care, many of them can live into their 30s or even 40s. So again, these are very complex issues and have a lot of ethical discussions that will take place due to this. So when you're completing the readings for this module, definitely think about how the pediatric nurse needs to assess and care for the child and the family with all of these different musculoskeletal and immobility disorders.